Hello, everyone. I am excited to have my friend and colleague, Dr. Christine Smith, on to talk about injury and sleep. So I will let her on as soon as I see her, which is right now. Okay. Christine, are you in? Oh, here we go. Oh, Christine, are you here? Oh, there
Hello.
you are. Yay. How are you?
I'm good. How are you?
Good, good. It's so good to see you.
Absolutely. You too. Thank you for having me.
Yeah, I'm excited about our conversation.
Me too. I think it'll be a really good one and something that I like. I've been meaning to address the component of sleep, and I think it's so important. So thanks. I'm excited.
Yeah, totally. Yeah, where do you want to start? I know we're going to talk a lot about injury and how you help with that. So, you
Sure.
ready to dive right in?
Sure. Well, I can kind of tell you a little bit about myself and how I ended up talking about injury so much because I think most people often think of like an ankle injury or tweaking your shoulder, but I kind of retrain clients on what they think of as an injury. And so I retrain them a lot around understanding physiology and how to understand when your body has entered a certain biochemical state, which is really kind of what an injury is. It's a flip in your biochemistry. And generally, all disease is a cascade of an injury that has gone awry, whether that's an injury to your blood vessel, or an injury to your gut, or an injury to your liver, or an injury to your shoulder, or whatever, or even an injury to your state of thinking. Like neuroscientists are now classifying PTSD as a traumatic brain injury. And a lot of people don't realize that. And so injury can even be if you're going through grief. And that often comes a lot with physical injury. Like if you're an athlete and all of a sudden you injure yourself kind of severely, you kind of go through an identity crisis and you grieve yourself a bit. And I think it's something that's not always talked about. So I love to kind of retrain people on that front because it allows us to have all the biochemical conversations we need to have anyway for helping someone to heal their body. And that can be things around making sure that your body's not dealing with toxins because toxins can cause injuries to our tissues at a microscopic level. This can be making sure that you have enough nutrients to actually rebuild and heal from that injury. And this can also have to do with your perception and your level of stress, which totally has to do with sleep because we all know that we don't feel super resilient mentally when we are not having
Yes.
good sleep. And sleep's a huge part of healing. So that's just a general way to think about it and a way we can start.
Yeah, I love it. I mean, so based on what you said, we're, dealing with injuries all the time, really. And the way I see it is a healthy body always wants to be back in balance, or the body always wants to be back in balance. So it's like we do have this amazing ability to constantly heal from injuries, repair injuries. But I think when there's too much stress, too many injuries, then that's when the body can't handle it.
Well,
And
it's that compounded effect without ever really
mhm.
a break, and that usually is what will send someone down the cascade of a chronic illness is that compound effect. Or I teach people about the concept of allostatic load, which is like your body's capacity for life. How much can you handle? And if you have trouble with sleeping, you can't handle as much. Or if you have trouble with your
Mhm.
hormones, you just don't feel as resilient or you don't bounce back as quick, which is why we also start to kind of feel our bodies more and have to be a little bit more careful once we pass that like 30, 40 age mark because we just don't have the same hormones to help us bounce back as we did in our 20s. And so just helping people understand their bodies in this kind of way where it's a bit more sustainable because I would rather teach people how to realize when their body is in an acute injury cascade, which means you just did something that made your biochemistry unhappy, and seeing if we can level it out and bring it back to that state of balance that you mentioned before tumbling down this like horrible cascade that's way harder to climb your way back out of than if you can just catch it after the first like time or two of your body being upset. And I think it's something that's totally missing from healthcare. Like we talk a lot about all the big systems and all the big organ systems and understanding lifestyle components, and I think that's really important. But we have this tendency in our society to have a symptom and want to cover it up or get rid of it in some way and make it go away, versus looking for why it's there and like what it's trying to tell us about our body and what the signal is. So I know like in some of your reels, you mentioned that you can have like a bunch of different things keeping you awake from sleep. And that can even be like your liver detoxing, or it can be hormone pathways that aren't quite working, or you can be a deficiency in minerals, like a whole bunch of different stuff. But ultimately, like if you're not detoxing well, we have a bigger problem to investigate. So having a hard time sleeping means that there are other things that need to be balanced, just like you talk about. So I think educating people to think about their bodies in that way is the evolution of healthcare and what will make our lives actually sustainable while we can still enjoy them.
Right. Yeah. Yeah. I mean, I always say too, like not sleeping well is just a sign that your body isn't healthy. It's your body's way of telling you that. And so if you just try and mask the symptom, then you're not dealing with what's actually causing it, which is the most important thing.
Yep.
So
exactly. And I feel the same way about like athletes. If you keep getting re-injured and you like keep tweaking your shoulder, or now you've like tweaked your knee and your shoulder, you've been in a state of inflammation. Like your ligaments are in a state where they're weaker, and we need to address that, because if you keep getting injured, it keeps inducing this weird inflammatory cascade, and you can actually start to retrain your immune system into a pro-inflammatory type of approach. And that is not great and much harder to reverse. And you can get caught in this, I'm gonna nerd out a little bit on the immune system. So you can get caught in this cycle of basically like your acute inflammation reactants, which is like your neutrophils and your Th17 cells, which are, you know, a type of T cell. They can come and they can try to do their job, but they end up kind of getting stuck in the tissues. And if you don't have enough of another type of your white blood cell, like your monocyte, to come and clean those up, then your body gets kind of overwhelmed. And then those acute reactants can actually start to basically degrade in the tissue, but they release all of their firepower as they degrade. So you actually start to damage your own tissue with your own immune cells because you haven't given your body a chance to clean stuff up. And that's another super important component of sleep, is it's when your body does this. And it's also when you produce cytokines to address things like infection. So if you are dealing with a parasite or detox issues or anything like that, sleep is the time when your body's going to work on it the most. And so that is why it's such a huge component. It's like this beautiful time that your body gets to reset and to clean and to clear out debris. And that's part of our glymphatic system, which is like how your brain cleans itself. And so I love all that stuff. I do like craniosacral work in my practice, which is basically working with the same fluid in the glymphatic system. And I see some great results just getting someone's body to like reset in that kind of between wake and sleep state for just a minute or two. So anyway, sorry, thanks for letting me nerd a little bit.
Oh, I love it. And I think people like that because it's stuff, yeah, you aren't reading everywhere and hearing everywhere. So yeah, I think it's great. I'm curious how you got into this. I mean, I know that you've dealt with some physical injuries, like what we think of as typical injuries, but I'm sure there's more to it.
Yeah, absolutely. So I guess I've been through a number of different experiences, but they all kind of have continued to lead me down this path. And, you know, I used to try some routes with conventional medicine for things like anxiety and also not being able to sleep. And it just didn't really work. And in some cases, it kind of pushed the chemistry down a pathway I was trying to get away from, which was kind of that like noradrenaline, norepinephrine pathway. And now that I know what I know about my neurotransmitters, I realize I probably should have taken a different approach earlier on, but you know, we all learn. And then I started really learning about how the mind can affect the body and how the body can affect the mind. I actually used to work in a couple of psych labs that did analysis on this, and it was really interesting seeing how different people will activate different parts of their brain with the same image based on earlier life experiences. And so it's a really interesting thing to realize how differently we all get stimulated by the same thing. And that really has to do with perception and like how you're perceiving your environment around you. And I started working with meditation early in my life, which I have found to be incredibly important, and that I probably did not give the amount of respect it deserved earlier in my life. But I'm now coming around because at another time, after I was a practitioner, I went through a couple back-to-back injuries and kept pushing. And this is why I give this advice now, is because I don't want you guys to go through this. Kept pushing, kept re-injuring, then had like just a stressful life event happen, and then had a bit of a mold exposure. And so it's just that compounding effect, that allostatic load, that my body was at capacity. And from that experience, my body became allergic to like everything, including like vitamins. I was a functional medicine practitioner that couldn't use vitamins. And my immune system was just, for the best term I can think of, out of whack. And it took a while to get it to regulate a bit, because all it was trying to do is protect me, but my body and my perception had entered this state of thinking that it was under attack. So worked with meditation on the perception to be like, I am not under attack, like it is okay. And that is more difficult than you'd think, but it has a lot to do with going inward and working with your own energy, because there's just some things you can't talk through. Sometimes you have to go have like a energetic conversation with your cells, and that's really only when you go inward. So had to take some time doing that. That allowed me to get past the major food sensitivities and calm my system down enough that I could bring foods back in, because from overdoing it with avoiding food, which, you know, that's just a tough situation to be in, it created some not great effects of fasting. Because I love fasting, I think it can be great, and I think a lot of people are super into it, but your adrenals have to be in the right place. And so if like you're having a hard time sleeping, you might not be the ideal candidate for fasting. Like your adrenals are already working really hard, and we have to find kind of this point of balance. So anyway, push my body a little bit too hard in that sense. My hormones kind of started having a really hard time and going down, and it was a really confusing time in my life. And ironically, it was also like the thinnest I've ever been. It's also the most unhealthy I've ever been. So just know that, you know, that doesn't always mean health. Like health really has to do with your biochemistry and how resilient it is and how adaptive it is. That's how I define health, is how resilient and how easily adaptable is your body to your environment. That's health, which is why it's not a destination and it's not a goal. It's like a system that we maintain. But as I was able to get those food sensitivities down, I was able to start working with some nutrients again. And I'm still in the process of kind of retraining my immune system from the mold exposure, because as life would have it, I just happened to have like 2 other exposures, and it's just bad luck. And but now that I know this about my physiology, this is why I teach people about this stuff, so that if this kind of thing happens to you, you can catch it before it goes down the crazy pathway. So like I've tested myself for a variety of things, and because of the way that I've managed my food and my lifestyle while my immune system was upset from the environmental exposure, I have yet to develop like autoimmune antibodies, which I'm trying to prevent from happening by controlling my lifestyle while I retrain my immune system. And I think people don't realize that it's the repetitive exposure and the repetitive stress that then ends up making your immune system do weird things. So even though like I can eat certain foods and like, yes, I'm technically okay, I know that if I wake up in the morning and I have like a little bit of puffiness over my eyelids, or I didn't sleep well that night, or whatever, it means that my body was processing something. My body was dealing with some kind of inflammation. Or like if you wake up and you're 4 pounds heavier, that is not weight that you gained. That's inflammation weight.
Right.
So just teaching people how to find these little things, because you can make such a big shift in your life while your body resets, which sometimes it needs time for, but it's designed to do that. So you just have to provide it the resources and the space to do so.
Yeah, exactly. Awesome. And how does the gut tie in?
Yeah. So the gut's huge, right? Like the gut is a gigantic part of everything in your body, way more than we've ever given it credit for. A lot of people don't realize that it's your second brain. It's called your enteric nervous system. It actually has as many neurons as a cat's brain. Let your mind wrap around that for a sec. And then it also sends more signals back to your brain than your brain sends to your gut. So your gut is communicating back to your brain all the time, and it produces a significant amount of our neurotransmitters, especially serotonin, which is a precursor to melatonin, which is the thing that helps you in your sleep. It helps to modulate your immune system. It's a huge antioxidant in your body. Melatonin does a lot more than like just making us sleep. It has a huge role in our immune system and in our gut and a bunch of stuff. So our gut is intimately connected to all of our biochemistry. And it's also the thing that deals with the most environmental exposure of anything in your body, except maybe your liver. Actually, even more than your liver, because it's the thing that is the first defense. And your gut, like the lumen, the space inside your intestine, is technically still outside your body. Even though it's inside, the stuff in it is not inside your body yet. So it has to go through the walls of that in order to do so. Now, if you get injured, one of the first things that happens with your immune system is your body goes into a state where your tissues are more permeable. It's like your cells kind of have more space in between them so that your immune cells can travel through and like get through and do their job. That's good in an acute sense. It's bad in a chronic sense. So if you keep re-injuring yourself, whether it's like continually twisting your ankle or working out a little bit too hard for your body without proper recovery, that's how like those really healthy athletes can all of a sudden have a heart condition or something like that because they haven't been recovering correctly and they've been pushing their body too hard. It can also come from just eating our standard American diet, which is appropriately named the SAD diet. And it's, you know, processed foods, like the definition of a processed food is it's something that you can't find in nature. And food is a signal to our body that nature very carefully derives. So if we start making different signals that are confused, our body is going to get confused because it's eating and consuming confused signals. And I think that's like the simplest way I can say it. And when you think about the fact that a whole foods diet in our society is considered a diet, it makes you realize how many processed things we have in our society. So we're dealing with all that, right? Like the chemicals that we make. We're not even talking about the chemicals that we spray on our food. Or now there's that like weird new wax that they're like putting on fruit that's really hard to get off. And it's even on organic fruit. It's like, geez, it's like sometimes talking about this stuff is frustrating because you are like, well, what am I supposed to eat? But at the same time, knowledge is power. And the more you know, the more you can figure out. So just, you know, look for the fruit without the weird wax on it and just know that that exists now. And when we start eating these things, a couple things can happen. If we have a lot of pesticides on our food, that starts to disrupt not just our gut lining, but also our microbiome. It actually can work as an antibiotic to the microbiome. Then that starts to give us dysbiosis. And when we have dysbiosis, the chemistry in our gut gets really off and we get more confused signals. We also get things like our dendritic cells in the gut lining, which are like these little white blood cells that sit in there and they sample things from the outside and they hand them to our immune cells and they go, make sure that's not dangerous. And they just sample and they hand them over. If we start having some tissue damage because our microbiome is starting to get damaged and there's kind of a battle going on, now these little cells accidentally grab a piece of self-tissue along with, say, like a food particle, and they hand it to our white blood cells. And our white blood cells start to tag our self-tissue, and this is how our body can get confused and start attacking our own tissues. One way of a couple ways. The other thing that can happen is we start basically getting like debris and like rust called like oxidative stress that builds up on our cells, and our immune system goes and tries to clean that up and take care of it, but this debris is damaging overall. And then ironically, as we get tissue damage, we get more of those acute immune cells coming in like the neutrophils, and they hang out, and then they start releasing all their stuff that actually creates more tissue damage, even though they're trying to be protective. And then it's just this whole cycle that we get caught in. And eventually we can start to get permeability in our gut, which is like where we have little holes between the cells. Food particles can leak through of innocuous foods like an egg. And then all of a sudden our immune system is like, that's not supposed to be here, tag that. And then all of a sudden we're sensitive to eggs, and we never knew. But because we've never been sensitive to eggs before, we keep eating them. And then our immune system keeps reacting to them. And then we get this upregulated immune response because of something that's just a part of our daily exposure, and we don't even know it's happening. And then all of a sudden we're like, I have had more headaches in the last couple months than I've had in the last couple years. This is like really weird. I don't understand why. Or, I've just been sleeping terribly, or I have been bloated and I don't really get it. And it happens when I eat this particular food. Whatever. And we just kind of write it off because nobody's ever talked to us about this stuff. So this is why I love to do this. But as we get caught in the cycle, it increases our inflammation. That increase in inflammation actually makes our ligaments more stretchy and a little bit weaker. And then it's easier to get re-injured, and then the whole cycle starts over again. And if you are starting to have leaky gut, it's kind of, unless you make some lifestyle changes, it's kind of self-perpetuating. So changing lifestyle, I teach people a lot of like, first thing we're going to do is the exact same thing your immune system does. We're just going to stop. We're going to like evaluate and assess and figure out what we need to take out to stop lighting things on fire. And then after we stop lighting things on fire, our body can start to enter a healing state. So that's where I really try to focus on teaching people, is like the stages of our immune system, how to realize when you're in a certain stage, and how to foster that stage so that you have longevity over time, because the gut is this huge regulator of it. So like my body, the example I gave earlier, even though I was dealing with an environmental exposure, my body was inflamed because of mycotoxins, I was able to really mediate and control the inflammation with food. And that was like one of the things that I had control over while my body was working on clearing out those other things. So I changed my allostatic load, right? Like my environmental factor load went up. So I took it down in the area that I could control, which was with my food. And if I have to like give up cheese for a little while to help my gut actually be sustainable into my late decades, that's important to me for the purpose of things like brain health and being able to go to Christmas dinner and being able to go on a vacation and enjoy it and not just sit there with joint pain the whole time. So when I talk to people about their goals of like why we're doing this, those are my goals, right? I'm not really thinking about tomorrow or next week. I'm thinking about 20 years from now and what I want to be able to do with my body. And that's why these small decisions that don't seem like much now matter later, because they're going to preserve your other tissues.
Yeah, definitely. Yeah. Awesome. Well, I know you're about to do a program about injury recovery. What is that all about?
Yeah. So I ended up designing this because of having this talk with so many people so many times. And I wanted it to be more accessible to people. So the stuff that I would teach people in like our first 7 appointments, I have put into like an online program that you can do at home. Every once in a while, I run them as a group program because I think healing with tribe and community is important. It's like making these changes, especially when they're lifestyle changes around habitual things that provide you comfort, which means that it has a serious influence on your dopamine pathways and your neurotransmitters and the things that you end up feeling addicted to, even if it's not a healthy lifestyle. Can be really hard to change by yourself. And sometimes it's way more fun to do it with community. And I think it's something that's been lost from healthcare. So it's actually one of my favorite ways to help people because it gives them a chance to listen to other people's questions and be like, I didn't even know that that was affecting me, but that is a thing for me. And it's like a question you didn't even know to ask. And then my conversation ends up going somewhere completely different than what I just teach you in an appointment, because I can teach you more in that 5-week course because of the stuff that you watch and then the conversations we have than I can in like 20 in-person appointments in office, because I just can explain things differently. And at one point I like take you on a tour through the grocery store in one of the videos and like teach you how to read labels and teach you tactics for shopping. And I've had a bunch of people be like, I didn't think I was going to learn anything from that, but actually I learned a lot. And I teach you about physiology, and I teach you how your gut works. And I also start to introduce some mindfulness, which I know is maybe something new for people, or it might be something that you are familiar with, but sometimes you lose motivation on. And so it's just a chance to reconnect with it and learn how to kind of have fun with it and see it as a creative thing. So I try to make it fun, because when you're dealing with a chronic health condition, it could be really not fun for a lot of the time. And so I try to bring some lightness into it, and this realization that like we're all dealing with these things at one point or another. And if we can just learn how to speak with our body and learn the language of our body, then we can develop this relationship with it over life that's much more sustainable. So it's designed to be kind of broad. So really it can kind of be for anybody. But, you know, I've had everything from someone healing from like a surgical procedure that they had done and like just wanted to get their body in the right place for healing. I've had somebody do it who was a couple of years post chemo and still just felt off, and then he felt amazing afterwards just doing the home program, and then decided to do the group program again because he wanted to continue his efforts but wanted the community, because they're different each time. I've had people who are working on fertility, or other people who just wanted to get some exercise back into their lives, or people working on arthritis, or people working on gut issues but wanting to just start with things at home. So it's a way to make things accessible for everybody, because not everyone is ready to come in and full on work with a practitioner. So it's called Foundations for Health. And I take you through an acronym that represents the different stages of healing and teach you so that it's a really simple way that you can think about your own biochemistry. And it's just foundations that everybody can use, and just understanding how to truly listen to your body. And then I collaborate with people like yourself, where you do, you know, courses on more specific niche things. For me, it's just about educating the public and making this all public knowledge, because people should just know how to take care of themselves. And I think it's something that's been oddly hidden and distracted from in our conventional system. Also, our conventional system just runs into time constraints, which is why I made a home course, is because that allows me to give a substantial amount of time to people in a feasible way that we wouldn't necessarily be able to do in office.
Yeah, that sounds amazing. And you know, I always say, like, our society does not make it easy to be healthy. Like, you can't just do what everyone else is doing and expect to be healthy. And so I think we do have to learn how to do that. And you and I have spent years and decades learning that for ourselves. And so now we're sharing it with others, because it's not taught anywhere, unfortunately. And so I think it sounds amazing what you're doing. And yeah, I think it will be really valuable.
I think it should be really fun. And, you know, I mean, what would you say is the most important thing that you want people to know about sleep in their body?
I mean, I think it's that a healthy body sleeps well. And so if you aren't sleeping, that's a sign that things aren't healthy. And I have people come to me all the time, like, but I eat healthy and I exercise and like take supplements, right? Like, they're trying to do all the right things. And I was the same way. Like, I cared about my health and still developed sleep issues. And I found out I had a parasite, I had hormone imbalance, I had copper toxicity, I was sensitive to gluten and dairy and eggs, like, and all those things were what was causing my sleep issues. And so, yes. And a lot of those were beyond my control, or, you know, and have been the culmination of a couple decades of caring about my health, but also still over drinking and over exercising and like, you know, in my 20s.
Those kinds of things, that's when it's important to, you know, like work with a practitioner. So, you know, if the stuff that I'm teaching is more like stuff for you to try at home. And then because it's like anything that you're working on is going to be benefited by this knowledge. It's just no matter what you're working on, it's just the foundations of how your physiology works. But like you're saying, it's like sometimes doing some additional testing can be really helpful, but it's really helpful to practitioners if you have spent a couple weeks analyzing your own body, and you come into the appointment being like, I feel this way when this happens, this bothers my system, I don't feel good when I do this, but this makes me feel better. It just like immediately gives us this platform that we can jump off of into what's going on in your system, because you know your body better than anybody else, and hearing your words to explain it helps us ask the right questions. So I think that's hugely important, because sometimes, and like I mentioned earlier, you can develop like a really weird immune sensitivity to something. And once you develop that sensitivity, your body has a memory for it, which means that you just might have to color inside the lines a little bit more than your average person, because of this immune response that you had one time, or maybe 2 times, or maybe 3 times. And now we just have to learn to listen to your body and catch it in those early stages. So that's kind of what it's for.
Yeah. And I agree, like you absolutely have to start with the foundations. That's where I have to start with everyone. You can't just kill a parasite. And, you know, like your liver needs to be detoxifying properly. You need to be working on gut health as well. And like, yeah, you absolutely have to start with the foundation. So you're just going to have a head start if you do this program on your own. And if it doesn't help, then then you get extra help. But I think it will also help a lot of people to just have those foundations in place.
Exactly. Well, and that's why I like the group program. It's like the in-between version, where it's like you get some input, and then you can decide from there what you want your next steps to be. Totally. And you might just be feeling better. And that's awesome. So that's the whole idea.
Exactly. Awesome. All right. Well, anything else you want to add?
No, this was great. Thank you so much.
Yeah, totally. So good to see you. And yes, we'll post info about Christine's program.
Yes, and there's one other thing I just realized I want to add. I will be doing a free masterclass around this stuff on the 20th at 10 a.m. Mountain Time. 20th is a Saturday. So May 20th, 10 a.m. Mountain Time, free masterclass if you guys want to learn more about this stuff and kind of how your immune system ties in, because I love teaching that. Link is in my bio here on Instagram, or you can just go to depth, depthwellness.com/resources.
Awesome. All right, everyone. Thanks for joining. And we'll see you on Instagram.
Sounds good. Have a great day.
You too. Bye.